Hello and welcome to Health Styles. I'm Connie Mead. It's a beautiful summer out there this year, and there's no better time to get out and enjoy the great outdoors. And while you may be diligent about applying your own sunscreen every day, it's important to remember to take care of your children's skin as well. That's because there's a direct correlation between your skin health in adulthood and your prior sun exposure in childhood. So today we take a look at this important issue and learn about the steps we can take to minimize future damage. Joining me today on our show are a couple of guests. First is Dr. Kathleen Joyce, who is a dermatologist with adult and pediatric dermatology in Concord and Westford. And also Meg Lemire-Berthel, who is the Director of Oncology Social Work and Community Outreach over at the Cancer Center at Lowell General Hospital. And I want to thank you both for being here today.
Thank you for having us.
Okay. So we want to talk a bit about protecting our skin and the importance of that, especially when it comes to children. So Meg, can you just start us off by giving us sort of the big picture and why this is an important discussion?
Lowell General Hospital Cancer Center is very committed to public education and informing the public about ways to prevent cancer. With a lifetime risk of 1 in 5 for United States adults getting skin cancer, extremely important to look at what we do as a child or what we do to our children is going to impact that risk as an adult. So I've asked Dr. Joyce to join me today because she specializes in pediatrics also, and what we can do to protect our children, therefore protecting ourselves as adults.
And so do you see many cases over at the, at the Cancer Center? You do? Yeah. Okay. So we wanted to prevent that from happening, and it sounds like this is a perfect case of an ounce of prevention is worth a pound of cure. Okay. So let's talk about this. So there is this correlation. Can you explain that to us?
Sure.
Why that is?
So there's thought to be an association between the amount of sun exposure that one receives in their childhood, specifically before the age of about 15, and the number of moles that one may have, throughout adulthood. And in addition to that, there's a correlation between the number of moles and your risk of skin cancer. So obviously decreasing UV exposure, ultraviolet exposure in childhood leads to fewer moles and less sun damage and ultimately less skin cancer, we hope. So critically important. And as you know, and as Meg referred to, skin cancer is an epidemic in this country right now. I mean, every year the numbers are increasing. The most recent statistic I read said that 3.5 million new cases of skin cancer have been diagnosed in about 2 million people in the past year in the United States. So it's an incredible number of cases. And of course, there's different kinds of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and melanoma. Melanoma is the most serious type in terms of total health effects, but basal and squamous cell cause significant lifestyle interruptions, the need for surgery, various treatments that are needed. So it costs a lot of money, and it costs inconvenience and scars and things of that nature. So prevention is very important for all different types of skin cancer.
So do you think, let me ask you, this increase is due to better detection, and so we're kind of just seeing the blossoming of all this that was already there, or is it, do you think there really is, maybe with the aging population, this is showing up?
I think, Connie, that it's thought to be a combination of both of those things. We are clearly better at detecting skin cancer. The public is becoming more aware of the need for skin cancer screenings, and so more people are getting their skin checked, and therefore more things are being detected, thankfully at an earlier stage as well. But also there's thought to be environmental factors. People talk about the ozone degradation as leading to more UV penetrating through and damaging the skin. And also people in the past few decades have done more outdoor activities and have become, outside more and doing more. And sunscreens, while they're widely available now, have improved in quality in recent years, but you know, several decades ago, they weren't used very well, and they also weren't very good. So I think it's a combination of both increased education as well as probably increased incidence as well in terms of skin cancer.
Sure.
And if you look back at the past 30 years, I mean, I'm getting there in age, but when I was a teenager, it was not sunscreen, it was baby oil.
Right, right. You slathered that all over
slathered
you.
on and baked in the sun.
Right, right.
Because I don't think we had the knowledge back then.
No, we didn't really.
Certainly, and our academy, the American Academy of Dermatologists, has been very active in promoting awareness of skin cancer and of protecting your skin. And you know, as we're talking about the pediatric population today, I think that's where our education, you know, needs to be at this point, because you know, their skin is going to be better than ours because we're doing a better job with them.
Right. Okay, well, let's move it along so that we can talk about sunscreens and what we can actually do. What are these steps that we can take to protect our children? So I'm going to start with sunscreen because I think that's the one that's most obvious to people, or one of the more obvious choices.
Right.
So what do we look for when we're purchasing sunscreen?
So you want to look for a few things. It's recommended that you make sure your sunscreen is what we call broad spectrum, which means it will block both UVA and UVB, the two components of light, of ultraviolet radiation that lead to sun damage and skin cancer. We recommend that you use an SPF, a sun protection factor, of greater than 30. An SPF of 30 will block approximately 98% of UVA and UVB rays in an effective fashion. When you go beyond that in terms of numbers, you know, these days you see SPF of 100, you see SPF of 80, you see things like that. All of those numbers are referring to the UVB protection factor. And with those newer sunscreens, you're probably gaining a little bit more stable sunscreen and therefore something that may work for a little bit longer period of time, but that does not negate the fact that you need to reapply it. So to summarize, you want to buy something that is broad spectrum, you want to buy something that is above an SPF of 30, so 30 or higher, and you want to remember to reapply it. That's another very crucial factor that we have to think about.
Okay, so when we're talking about reapplying it, how often do we have to reapply it?
Right, so the rule of thumb is every 2 hours. However, if you're going to be sweating heavily or if you're going to be swimming and then toweling off, you probably want to reapply immediately after either of those activities. Like if you went for a run and got all sweaty, then you get dried off and you need to reapply immediately. Same thing when you get out of the pool, towel off your kids, that's the time to do it again.
Okay, and so when to apply? Do we just do this if we're going to be outside, you know, spending the day outdoors at the park or at the beach, or do we do this every day of the year?
Right, absolutely, the latter situation. So you want to be making this part of your daily routine because it's that long-term protection that's going to protect you from cumulative UV damage and skin cancer ultimately. So let me just tell you how I would tell a parent of one of my patients, you know, what I tell them, because there's lots of different forms of sunscreen, and some are easier to use, some are harder to use. And so obviously, well, let me just say, I have 4 children of my own, all under the age of 6, so I have a lot of experience doing this. So I can tell you, it's not easy to get sunscreen on a child. Some days it's next to impossible, actually. So you can choose from the various types of sunscreen to make your life a little bit easier. And we'll probably get to ingredients in the sunscreen a little bit later. But I always tell the parents of my patients that it's best to, for your first application of the day, choose something like a lotion, because that's going to you know, give you very comprehensive coverage. So you apply it liberally to the skin, you rub it in very well, and then you should do this about 20 minutes before you're going to be going outside, so it has time to sort of adhere to your skin.
Okay, so when you say a lotion,
I did bring some examples. Yep. So this is an example of a lotion, which is thinner than a cream, but you know, not a spray or a stick, which are some of the other forms that are available.
So does it say lotion as opposed to
It
cream?
does say sunscreen lotion.
Okay, lotion.
The great majority of products available in every drugstore, you know, everywhere that you buy these are lotions. Some of the other products are just sort of other forms that are available now. So for many parents, if you can get this done in the morning before you're going to the park or whatever you're going to do, going outside in your yard to play, that's a great first step. And then for the reapplication, you know, a lot of parents prefer sprays. I think that sprays are challenging because you can miss areas, you don't get as complete coverage as you do with something that you're actually rubbing into the skin. And also, some of the ingredients that we advocate in the sunscreens are not as readily available in the sprays. However, these are great if you're out, if you need to do a reapplication. Very easy. It only takes a few seconds, you know, and so kids will hold still for that long. So
Right.
for older children, these are great.
Okay, because they want to get back to playing.
Right. Just one other thing while we're on that topic. My children are very easy, take very easily to these waxy sticks. I use these on their face and on their ears, on the areas that are very important to cover, however, difficult to get with children because they move so much. So,
Sure.
and these also last pretty well because they're waxy, and so they stay in place pretty well. So those are just some of the tricks that I use for my own children and try to teach the parents of some of my patients.
Okay. Now, how close to your eye? I mean, that was always a challenge with me with my children. It's like, it's in my eyes, it's stinging, and this sort of thing. And maybe that's because it was a lotion. But with those sticks, I mean, or any of them, how close can you come to the eye?
I like to come close to the eyelid margin, which is about right here, just a few millimeters below where the eyelashes are.
Okay.
And then for the upper lid, with something like a stick, you are able to sort of have them close their eye and do one little swipe like that. You're always concerned about whether you're going to get it into their eyes, and that may bring us to speak about the ingredients in sunscreen, because children have sensitive skin, and so they may tolerate certain ingredients more so than others. I have found
You say they tolerate it or they don't tolerate it?
in terms of the stinging and the irritation that you mentioned. So there's two types of ingredients in sunscreen. There are the chemical sunscreens. You may have heard words like oxybenzone or avobenzone, ecampsyl, mexoryl. Those are all words that are chemical sunscreens that are in a lot of these products. The non-chemical sunscreens, or the physical sunscreens, are zinc oxide and titanium dioxide. And those are ingredients that I think are great for children because there's much less risk of that sensitivity of the skin and the stinging of the eyes and things like that. And they're just very high-quality ingredients. They offer good UVA and UVB protection, and I think they're a good option for children.
Okay.
I choose those for my own children.
Oh, okay.
I do.
And now, is that something different from this other sunscreen you have here?
This sunscreen in the pink bottle actually does have zinc as one of its active ingredients. And so you just look on the back, read the active ingredients, and you can find what you're looking for. The stick that I showed you before is also a zinc-based product. And this, which I haven't shown, this is just another brand that is popular these days. This has only zinc. It doesn't have any chemicals in it at all. Some people are looking for things that don't have chemicals at all, and this is one that is one of those.
Okay, but as you say, that's more expensive, or you don't find that everywhere. I'm just
some of the zinc or some of these zinc-based products are harder to find. That is definitely true, and sometimes they are more expensive, and so they may not be for everyone. There was a controversy brought up by a group called the Environmental Working Group regarding sunscreens, which you may be familiar with, and they have said that certain ingredients in sunscreens that are widely available may actually be harmful. Specifically, they spoke of oxybenzone, and their concern regarding that ingredient is that it's thought to perhaps be what is called a hormone mimicker, which could cause problems with the endocrine system in children or in adults. So that is what was brought up about that. And the other ingredient that they brought up was called retinol palmitate, which is commonly found in a lot of sunscreens. And the American Academy of Dermatology stands by saying that these ingredients have been in sunscreens for decades, and there's no evidence that there's any harmful effects from them. However, if people want to follow the Environmental Working Group as well as dermatologists and choose something, this sunscreen, which I showed you a moment ago, called Badger, is the one that got the highest ranking from the Environmental Working Group. The only active ingredient in here is zinc oxide, and this is what they chose.
Okay.
So, yeah.
All right. Let me ask to it, what age you should start putting sunscreen on your child?
So it's recommended to start after the age of 6 months.
Okay.
And you are told with infants less than 6 months to use shade and just avoidance of the sun as your main measures for protecting those children.
Okay.
There really shouldn't be a reason when a 4 or 5 month old baby needs to be out at the beach exposed to the sun for the whole day.
Right. They definitely need shade at that age.
Absolutely.
Right. So just keep them in the shade, and they should be okay with that.
Absolutely, yes.
Okay. The other concern I have with applying sunscreen is we hear a lot about people having vitamin D deficiencies and how we need to take more vitamin D, and they're even thinking of raising the limits, I think, on the recommendations for vitamin D. So now, how does all this sunscreen affect vitamin D absorption? Because we get that through our skin, correct?
It is true that vitamin D is metabolized in the skin. So there's, again, a lot of controversy about this issue right now as to, first of all, how much vitamin D do we need, and do we need to be exposed to the sun in order to get this vitamin D? So what dermatologists recommend, because we're the ones that see a lot of the skin cancers and take care of the people that have unfortunate problems from exposure to the sun, we recommend that you protect your skin and you supplement the vitamin D via your diet. Dietary sources are available, fortified milks, yogurts, things like that. Some people eat certain fish to get it, and also just supplements that you would take. And the American Academy of Pediatrics actually recommended supplementing vitamin D to children via supplements as well about a year ago, I think. So, so that is how, our stand on that. It is true that if you protect your skin from the sun, you may, in theory, have a lower vitamin D level than someone that does not. That being said, I see patients all the time that are very tan, that have a lot of sun damage, and I look in their chart and they have a very low vitamin D. So I think there's still some understanding of the process of processing of vitamin D that the people are still looking into right now. I don't think we understand the biology completely at this point. So probably more to follow on that in coming years.
Okay. You mentioned people being tanned. Now, are there certain people who have to pay more attention to this than other people because of their genetics, that they may have darker skin to begin with? Do they have to be as concerned with sunscreen as the rest, say someone like yourself is there?
So I think the challenges are different, and someone like me who basically does not get tan if I go outside, I think you learn from experience that it's not good for you to not use your sunscreen.
Right.
So obviously a fair-skinned person needs to be very conscientious about applying sunscreen and avoiding the sun and just being smart about sun exposure. But darker-skinned people get skin cancer as well, and we see it in our office every day. So I think it's a critical message to get out to the public that even if you do get tan, you need to protect your skin. And tan is a sign of sun damage, and so your skin is telling you that you need to do a better job if you're getting a lot of tan on your skin.
Okay, that's good. That's a good point, a good thing to know. Okay, so we've talked about sunscreens, but there are other ways to protect your children, and one way is through clothing.
Right.
And so do you want to talk about that? I know we have some helpers here today.
Yes. I am a huge supporter of using sun protective clothing, so I'm going to ask my son James to come up here and show me how he would be dressed to go to the beach. Stand right here with Mommy. So this is James, and he's showing us what he wears when he goes to the beach. This is called a rash guard or a sun protective shirt.
Can I touch it? Okay.
And you can see it's still fairly stylish looking. We
lightweight.
try to find one that that he likes each year that he'll wear. So this is great because this doesn't rub off. If he goes in the ocean and comes back out, I only have to reapply sunscreen to limited parts of his body because most of him is protected by this fabric. And the fabric, like sunscreens, is rated based on how well it will protect you. So most sun protective clothing that's available in the United States is called ultraviolet protection factor 50 or greater. So that's what this is. And it does a great job. It's durable. It protects them. Another component of his outfit here is this great hat, which has a wide brim, which is important, protecting the face. It also has this flap in the back for active young guys that need their ears protected as well as the back of his neck. And so these are great. And sunglasses. We haven't talked about the eyes yet today, but cataracts as well as ocular melanoma can be caused by UV exposure to the eyes. And so choosing a pair of sunglasses for yourself as well as for your children that will protect their eyes when they're outside is very important.
Okay, let me just back up a bit and ask about the shirt. Now, I used to put my kids just in a T-shirt when we'd go to the beach. That doesn't offer enough protection, does it?
A white T-shirt is thought to have a protective factor of about 8. And as I said, this has about 50, and you can feel how light this is.
Right,
so
right. So it's very comfortable.
It doesn't make you hot. I wear it myself.
Yeah. Okay. You wear one
I
yourself?
do, because I think it's important to set an example for your children as well.
Good.
So,
Good.
So James and I have a few other pieces that we can show you, just examples.
Sure.
So my younger son, John, wears a hat like this, which is just a more traditional bucket hat, but as you can see, with a wide brim to protect the face. And my daughter, Nora, has a hat, a nice floppy, fashionable-looking hat. Again, these are all fabric that's rated for good
Okay,
sun
so this
protection.
is a special kind of sun protective hat. It's not just something you'd get at any discount store necessarily.
They're becoming more widely available. And
Okay.
as I said, that UPF rating that we talked about, that would be on the tag of the
Okay.
shirt as you're buying it. So
Okay.
even a few years ago, they were hard to find, but now they're available in, you know, some common places that people would go. This
Okay.
is just a shirt that a little girl might wear. My daughter wears this one.
Same sort of thing as this
Same
one here?
thing, yes,
Okay.
exactly. And a little skirt rather than, you know, your traditional bottom, so a little more coverage of the legs is offered by these. Yep. Now this is a little bit more extreme. Some children would give their parents trouble rather than wearing this, but this is a full body suit that, you know, younger children, you can get into this, like babies and things, and toddlers. It's great
Right.
for them. Makes
So
your
this
life a lot easier.
This would actually be long sleeved.
I think it's about elbow length.
Yeah, pretty close.
Little
on
bit
it.
below the elbow.
Maybe like
So
a
you
3-year-old
can
or
see
something.
as a mom how it would make your life easier.
Yes,
Yeah.
yes.
So, and just another hat, you know, for one of, like, my younger children would wear one of these. Oh, this
Like
is
an
my
explorer.
hat. Yeah, so to
Yeah.
set a good
Oh, that's
example
right,
for your
yes.
children, you just have to do the same thing, right, James? Does Mommy always wear her hat and her sunglasses?
Yes. Okay.
So-
That's advertisement. That you
Absolutely.
have here. Well, this is really interesting, and I didn't realize that these were so readily available.
They are now,
Yes.
yes. In the last few years, they've become much easier to find, which I've been happy to see.
Okay, great.
Yeah.
Well, thank you for helping us, James.
Thank you, James.
Okay, you can take your sunglasses off if you want so you can see where you're going.
Thanks, Meg.
Well, that's interesting. And so the other thing I want to mention is avoidance. You talked about that in terms of babies and keeping them out of
Right.
the sun.
Right.
That's
So we
another
should-
way to avoid exposure, I would imagine, during the critical
We-
times of day.
Yeah, we should always do that. We should all try to seek the shade when possible, avoid the peak hours of sunlight, which most people are aware are between 10 a.m. and 4 p.m. So try to make your visits to the beach or to the park or whatnot before or after those hours. So those are important things. Sun protective clothing, as we've just demonstrated, I think is very important as well. And, you know, just generally good behavior, just being smart about it is very helpful.
Okay. I know one thing that's popular with teenagers particularly is like tanning boots and trying to get a jump on their tan. What do you have to say about that?
Right, so that's absolutely an important issue. I mean, I recently read that 50 to 60% of the patrons of tanning booths or tanning salons are teenage women between women between the age of 16 and 29, as well as their mothers. And so that makes tanning bed use kind of a women's health issue, if you will, and certainly a skin cancer prevention issue, because the light that you get exposed to in a tanning bed is proven to cause skin cancer, specifically melanoma. It's thought to be very much correlated. The World Health Organization recently put tanning bed lamps in the same category as tobacco in terms of carcinogenicity. So, in carcinogenicity, their ability to cause cancer. So, it's critically important, and it's definitely an issue. And there are still young girls that are going to tanning beds. I mean, we see melanomas in young people, and we think that it's highly likely that some of those people it was caused by those tanning beds. So it's devastating when we diagnose something like that. So it's very important. It's you know, there's a lot of legislation going on in various states about the taxing and of those salons and things, and it's very important to, you know, do all we can to advocate against the use of those at any level.
Yeah, and particularly in high schools, I would think that it would tie into their education, their health education
I hope so,
curriculum,
yes.
where you'd want it to, yes.
And I think it's real important to mention, and I didn't want this talk to be about melanoma, but how serious melanoma is. Melanoma is often deadly.
Absolutely, yes.
And maybe you could comment on the seriousness of that.
Right. So, absolutely, melanoma is a deadly cancer, especially in young people. It is the number one cause of death by cancer in age 25 to 29, and if you expand that to like 15 to 29, it's still number 2.
Yeah.
So it kills people, and it kills young people. It kills people in the prime of their life, and it is completely a preventable disease. We think there are probably cases in which there's a genetic predisposition, but the great majority of cases are on areas where the sun plays a critical role in causing the disease. we're getting much better at detecting it,
Yeah.
probably because of the public awareness we spoke of earlier. And so because people are coming in and we're diagnosing them earlier where it's curable.
Right.
But if the melanoma gets beyond the skin, it's a dismal diagnosis. There's very little that can be done for those patients. Again, there have been some breakthroughs in the past year in terms of treating disseminated melanoma or metastatic melanoma, but we're still not very good at treating that disease. So preventing it is where we need to be, and diagnosing it early, which is what we hope to do in our offices.
Right. So tanning beds is one area where you can definitely prevent it.
Absolutely.
And because that, you say, almost invariably leads to
There's
that
some
kind of
very
cancer.
good scientific evidence that exposure to tanning beds significantly increases the risk of melanoma.
Okay. Okay. So that's something that's very sobering information there.
Absolutely.
So I just want to add sort of my own personal story here, if I can, even though I know that you're our guest. I want to mention, I think this is all great, and I think it's wonderful, and we all take this in as parents, and I know many of us, like myself, when my kids were growing up, we practice it day to day. I made a drastic mistake one time, and I let my son, I won't say this, it wasn't a mistake to let my son go off with another family on vacation, but I had given him the sunscreen. I said, here's your sunscreen, put it on. I had told the mother, you know, here's the sunscreen, yada, yada. Anyway, he came home, and he was burnt to a crisp. And the mother was very apologetic, and she just didn't realize, because her children never burned. And she just didn't realize that you had to keep putting the sunscreen on, that you can't let them just go out from 9 in the morning till 5 at night in the surf and the sun, you know, and he was a fair redhead, and, you know, he was just miserable. I was frantic, you know, I was just so upset about it after trying so hard to protect his skin. Actually, it was a one-time occurrence, and he's very good now about putting the sunscreen on, but I guess my point is that you just, even though you're on a page, you know what you're doing. You can't count on everybody else to know what you know or to appreciate that.
I think you also have to teach the child. As an example, our grandson goes to a day camp. I have the very good sunscreen in his bag. And yes, the majority of the time they remember to put it on him. But I say to him every day, it's also your responsibility. You need to put it on if they don't. And kids, 7, 8, they can be taught this.
Right. And I guess I just counted on him to do that without realizing that, you know, he was going to forget, and it was just not going to happen. So,
well, I was actually very happy the other day, Connie, because one of my patients was telling me in front of her mother that I told Mommy that she needed to put my sunscreen on before I went to summer camp the other day. I thought that was great. So I do think that while it's challenging, the better job we can do to educate them at the age of my children, the better they're going to know to do it as they get older. And I'm sure there'll be times when they don't do it. And my husband tells me that what happened to you is going to happen to me someday. And what am I going to do when they come home all burned? But, you know, we do the best we can, I guess, and I think it's all about educating them. And I think the message is getting through, because like I said, this young girl, age 10 or 11, said to me, I told Mommy that she forgot to put my sunscreen on. So we're getting there.
And it becomes a habit. It's just like brushing your teeth or whatever. It just becomes part of their daily routine, and then it becomes a habit. So that, you know, they've been taking that in and
The other
assimilated
thing
that
you need to
information.
remember is sunscreens have expiration dates.
Absolutely.
That's a good point.
And I don't think a lot of people realize it, because it was my grandson who came home from camp, and I guess I had got these packets, and I had last year put them in his backpack, and he said to me, Grammy, these are expired. So you have to make sure you're working with stuff that's going to work.
Exactly. I don't know. They must have the expiration date on here somewhere.
It's hard to find sometimes. And they actually have quite a long shelf life, which in terms of the Food and Drug Administration, here it is right here on the bottom of this one, December of 2011, but approximately a year to 2 years, which is a pretty long shelf life. But I always try to tell people that if that's sitting in your house for 2 years, you're not using enough of it. You're supposed to use an ounce. Which is a shot glass full of sunscreen for an adult. Now, we'd have to modify that for a child slightly, but an ounce with every application, if you're reapplying, as we talked about, that won't last you through the summer. They don't last in my house.
Okay, well, thank you. I think we're going to have to leave it there, but it was very enlightening to hear about how to dress our children, how to protect their skin through sunscreen, and also to take some of this information in ourselves, because we can still use it, I'm sure. Thank you for joining us today. I'm glad you could be here.
Thank you.
And I want to thank you for joining us as well at home. Please join us next time.